Hi everyone, my name is Allison Lucchese. I'm a fellow AMFT here at Embracing You Therapy. I wanted to focus this short video on addressing common misconceptions about BFRBs. And just to jump right in, the first misconception I'd like to address is the idea that BFRBs are a form of OCD. So a lot of times people think that BFRBs are a form of OCD because of repetitive / seemingly compulsive behaviors that are done. However, there are clear differences, one beginning with treatment modalities. So with BFRBs, we stick with cognitive behavioral therapy that is very function-based. I think, actually looking back, a couple weeks ago I did a video on the Comp B model, which is specifically related to BFRBs. So for OCD, on the other hand, ERP, otherwise known as exposure and response prevention, is the main form of treatment, which again, I also did another video. If you're interested, feel free to click back or look back to those videos to get a better understanding of each treatment modality. Another difference between BFRBs and OCD is medication, right? So BFRBs don't react the same to the medication given to someone who has OCD. And then lastly, we really want to focus on obsessions and compulsions for OCD. So for someone who's struggling with OCD, if they have an obsession / a fear, a lot of times they will do a compulsion to try to reduce that fear. And it only causes temporary relief. And a lot of times the person struggling with the compulsions absolutely dread them. They can't wait to not do them anymore. Whereas someone who has a BFRB, they don't have that obsessive thought of, if I don't pull or if I don't pick, then someone will get hurt or then I will get hurt. That tends to not be present with BFRBs. The other thing is when engaging in BFRBs, a person will sometimes find relief. Again, the act of engaging in BFRB behaviors is to reduce a number of negative sensations, cognitions, emotions, and a lot of times it serves as a self-regulating function. Which brings me to my next misconception of BFRBs being another form of self-harm. So when we look at body-focused repetitive behaviors and self-harm, we want to focus on intention here. So although BFRBs can cause damage to the body due to the pulling of hair or picking of skin, the goal is actually quite different. So when we look at self-harm, think of cutting, scratching, burning even. It's done with the intention to harm one's body, to reduce the overwhelming sensation or emotional pain, manifested to physical pain to then drown out the emotional pain. BFRBs are, for many people, like I said earlier, it's a form to self-regulate. And sometimes it serves some internal need. So when a person engages in their BFRB, physical damage may be created as a result of their behavior, but it isn't an intentional result. It's actually very unintentional. And the last myth I would like to address, it's kind of two, but I combine them into one, is that BFRBs are a result of only anxiety or they are a result of a traumatic experience. That isn't always the case with both anxiety or trauma. So a person may have experienced something bad happen in their lives, or a person may have actual anxiety about something, but it wasn't the root cause of BFRBs. So here we want to understand what the triggers are for BFRB specifically. And when I say this, I'm keeping the CompB model in mind of what domain does this fall under. Does it fall under the cognitive domain, affect domain, sensory domain, or the place domain? And then once we can get an understanding of that, it's, again, fulfilling that self-monitoring form and creating an action plan to change certain behaviors. So even though, yes, some anxiety may be present, or even though, okay, a person went through something that was really heavy or that was really hard, there isn't enough evidence out there that shows, okay, it's one or the other. It's more complex than that. So if you have any more questions, or if you're interested in learning more about BFRBs, or if you think you're struggling with some body-focused repetitive behaviors, feel free to give our clinic a call for a free consultation. And of course, you can leave questions here down below in the comment box, and always feel free to subscribe for more info. Hope you all have an awesome day.